And finally, disc disease, failed back surgery, which of course anybody who has had these or has these knows what this can cause. If we're looking at the low back as an example, this is the top-down view on a vertebrae and the disc here. When a disc tears or bulges, it bulges back into these nerve roots here coming off the spinal cord. And then that's where you get your pain down your leg, or pain down both legs, the poker in the butt, that type of pain. In the neck, again, like we showed back in the fibromyalgia example, you can see where the bulges start to push up against the spinal cord and change its shape a little bit. It only takes that little bit of pressure to cause a great deal of pain. Recognize also that where we see there's this little white strip here in front of the spinal cord running down. What the MRI is not sensitive enough to pick up is that it's in that white space immediately in front of the spinal cord where all of the spinal cord's blood vessels are lying to feed the spinal cord. What actually happens first, before somebody actually gets a pinching of the spinal cord, is they actually pinch the blood vessels that supply blood and oxygen and nutrients to the spinal cord. So you can still have nerve pain even though somebody might come out and say your MRI looks normal, because it's not actually pressing on the spinal cord. Okay? So there are very specific ways that you have to read an MRI. Also, people who have had histories of these and don't deal with them like I would deal with them, they maybe go to surgery right away, or they have epidurals for a while until those don't work anymore, or they have surgery. Typical surgery is to do either a laminectomy or a discectomy infusion. This is an example of a laminectomy where this section of bone is literally taken off, and they go in and they move the section of the protruding disc. Now, they don't reattach the lamina, so that causes a problem in and of itself mechanically later on. But also, you leave a weak point in the disc. And of course, you never fixed the reason that this disc bulged in the first place. There's extra stress on that bulge, which is why it blows out. No different than a just weak spot in a tire. If you don't take the stress off that area, guess what? It's just going to become problematic later on. So what ends up happening is the person has surgery, and anybody who's had surgery, has had family or friends that have had surgery, knows that after 4 or 5 years after the surgery, they're back in to see the surgeon again because the next level above or below is now deteriorating and has to be fused. And it literally becomes a domino effect. So what we try to do is something called MUA, like Alan mentioned, which stands for manipulation under anesthesia, under sedation, you could call it. But basically what it is, and you can see Dr. Schrock and I have a couple of pictures doing it. What it is the person, and this is actually a very old osteopathic technique. It was developed back in the 1920s, so it's not even like it's new. Unfortunately, few people have heard of it. What it is the person is given an IV sedation, usually Versed or Diprivan is the medication. And it puts you basically into twilight sleep. And while you're asleep, the medication induces muscle relaxation. So in the clinic, for example, if this person had walked into my office and had a disc herniation, chances are it's going to be too painful for us to work on in the office. Well, the problem is if you want to make a disc healthy again, the first thing you have to do is restore motion to that disc. Because again, going back to a few slides back, joint immobility is the first phase of joint destruction. So if you want to repair a joint, you want to reverse joint destruction, you have to mobilize it. But most people, by the time they get to this point, you want to mobilize it in the clinic and they probably want to punch me in the head. Okay? So this way, giving them the medication, it relaxes all their muscles around the area, and of course, then there's no pain limitation. So now we can take the involved joints through their normal, full, complete range of motion with no pain and no muscle resistance. The entire procedure takes about a half hour, and it's repeated for 3 days in a row, sometimes up to 5, depending on how severe the condition is. And again, it has 90 years worth of data behind it to show that it works very consistently. Has no side effect. It's of any spine procedure, especially one requiring anesthesia, it's by far the safest in terms of published adverse reactions.
You do this right at your office?
No, we actually, you have to do it at an outpatient surgery center. We do it down in Lake Orion at Bald Mountain Surgery Center. And they're just showing a sample of the different styles of techniques, like working on the hip joints up here, down here. You can work on the cervical spine for neck herniations. And it works very well. And then they come in after the 3 days of manipulation. They come into the office for 4 to 6 weeks of physical therapy, and then they're done. And we even have our own published research on it to show that even 3 and 5 years later, people who even have this after having had failed back surgery, where they're looking at a second or a third surgery, are still pain-free after having this done, because we addressed the right problem. Auto, yes.